Eyes for looking all around, a brain in your head for understanding what's going on around here. Feelings inside for making friends and making starts and happy endings. Plenty of room for understanding what's going on around here. If your brain and your skin and your teeth and your tongue and your eyes and your ears and your heart and your lungs are in the right place, you're okay, easy to tell. You're fit as a fiddle and sound as a bell. Well, 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 well.
Being healthy really is important, and your own health largely depends on you. For instance, it's up to you to make sure you're getting a balanced diet, and you're the one who has to make sure that you're getting the right amount of exercise and rest. But you can't do it all by yourself. It's unlikely that any of us can stay totally healthy without the special help of some trained people whose job it is to help you stay healthy. Come on, I'll take you to meet some of them. Ken, what is a doctor?
He's a person who helps look after your general health. He's an expert whose training has taught him how the body works and how to put it back together again when it goes wrong.
Mm-hmm. What sort of doctors are there?
There are lots of different sorts of doctors, and probably the best way to explain it is if you think of your car. If something goes wrong with your car, you tend to take it along to your local service station, and the garage man will look at your car and he may be able to fix it up. And this is like going along to your general practitioner who may be able to help you get over your illness. Sometimes the gearbox, for instance, might have gone wrong and he can't fix that up himself, so he sends you off to a specialist. And the specialist may be a person who looks after a particular part of the body or looks after particular special sorts of illnesses.
Who are some of the people who work with doctors?
Well, there are lots of different sorts of people involved. The most obvious, always in a hospital particularly, and in a doctor's surgery, is the nurse. And the nurse is the doctor's aide and helps with the general looking after of the patient. But there are some other special people. If, for instance, you might break your arm and you go along and the doctor fixes your arm, you need some exercises to help you get over this afterwards, and the physiotherapist might help you with that. There's occupational therapists who will help you to entertain you and to continue on working, and there are people called rehabilitation specialists who get you back into your normal lifestyle after you've had a particular illness.
When do we need a doctor?
We need a doctor, I think, when we can no longer look after our own health. Sometimes we get a little minor cut, or we just might get a headache, and we can fix that up quite easily ourselves. However, there are other times when we can't help ourselves and we need to go along to the expert to get that sort of help.
How can a doctor help?
Well, a doctor, first of all, needs to be able to work out what is wrong with your body and what the causes of things going wrong. It might be an infection, or it might be something you've eaten or drunk which is incorrect, and you need to have those. So he's got to ask you lots of questions.
Mm-hmm. Well, all right, what sort of information should a person bring along to the doctor when he goes along to see him?
He's first going to know a lot about the details of the actual illness, when you first started getting sick and how long it's been going, if you've got a pain, exactly where the pain is, if you've been vomiting or having any problems in that sort of nature. He's going to know all those details. He's going to need wider details, like if anyone else in the family is sick, because if one person's got chicken pox, for instance, the whole rest of the family might have chicken pox, and we must just be seeing this early. We need to examine the patient after we've got their history, and the examination is first just generally looking at the patient, but then we need to use some special instruments. For instance, we have a blood pressure machine here, and this helps measure the pressure of blood flowing around in the arteries of the body, which will help us tell how well the heart's working and whether it's working efficiently or not. We have a very fancy light or torch here which helps us look into certain parts which we can't usually see in. We can look into the ears through this instrument and see if there's any problems like infections in the ears, and by adding a different top to it we can have a look into the eyes and tell about the eyes. We can also look into the mouth, and we may need to use a tongue blade. This is to push down on the tongue so that we can see at the back of the throat.
Say ah.
This is a bit unpleasant often because it makes you feel like you're going to gag,
Yeah.
but sometimes we have to do slightly unpleasant things to find the exact answers.
And that's a stethoscope, isn't it?
Yes, this is a stethoscope. All doctors have these, and these parts go into your ears, and this goes onto the patient so that you can actually hear what's going on inside the patient's body. We can listen to the heart, and we can listen to the lungs, and we can listen to see if your breakfast's going round in the right direction.
Well, it's the doctor who's concerned with the prevention and treatment of illnesses in their patients. And often this means making people take various medicines, which brings us to the next person I'd like you to meet. Keith, what sort of things does a chemist do?
Well, the chemist's main job is to dispense prescriptions that are sent to him from doctors and dentists and vets. So really his main job is to supply medicines to sick people or sick animals. But equally important is the fact that he's able to talk to the patient and explain how the medicine is best taken. That's just as important as giving the medicine. For instance, all of these things here are penicillin. Some are capsules, some are tablets, some is one is an injection. And it's very important that the patient knows that penicillin's taken on an empty stomach so that it works better. There are other medicines that have got other problems. These two over here, the one on the left makes people sleepy. So if you were driving a car, you'd have to be very careful. Or if you were one of those people that walked around girders on buildings, you wouldn't be able to take the one on the left, because if you were drowsy up there, it'd be pretty bad.
What's the difference between the sort of drug that you can just buy, over the counter, and the sort of drug which is prescribed?
Well, a lot of drugs are only available on prescription, and the doctor prescribes those, but there's a lot of minor ailments. If you get toothache or a headache or a pimple or you cut your skin, it's obviously not important enough to see the doctor, and the chemist is there all the time. He will look at you and tell you what is the best preparation for some minor illness, and if he thinks it's serious, he'll direct you to go off and see the doctor.
What are the responsibilities of somebody taking a drug on prescription?
Well, drugs these days are very, very strong, and in the old days people often took them by spoons. Well, nowadays we have graduated medicine measures, and as you can see, they're graduated very accurately, so that if a doctor wants the patient to have 5 mils, which in the old days was a teaspoon, it measures up to here. In fact, this, which looks like a very big eyedropper, is in fact a medicine measure, and it has graduations up here so that very small doses for babies can be administered with this dropper. They just put it in the medicine and fill it to the right level, and then they can drop it either into the baby's mouth or they can drop it into the milk. So these days there's an awful lot of work being done on getting exactly the right dose to the patient.
What are some of the other things that chemists sell?
Well, we sell products for the hair and for the nails. A lot of chemists sell beauty preparations, but basically our job is to sell medicines, things that people need for their health. And very importantly, the chemist is always there so he can advise you on what is the best preparation and the safest preparation for what you want.
And how can kids, boys and girls, benefit from going to a chemist? What sort of things can they ask a chemist?
Well, we get asked all sorts of things. The common one are things for pimples and skin complaints. We often get asked things about hair, dandruff, this type of thing. Something that's not quite major enough to go to a doctor, but which is a real problem to the kid concerned. The big deal with chemists, I think, is that we're here all the time. You don't have to make an appointment. The chemist is in the shop from the time it opens to the time it closes.
And Keith, it's very important, isn't it, that a chemist explain to kids exactly how to take the medicine?
Yes, we have got a series of labels that are printed, and these are stuck to the bottle. For instance, you'll see on this particular bottle that the third label is on the bottom. Now that label says this medicine should be taken 1 hour before each meal. This is for products like penicillin that only work on an empty stomach. There are other labels. This one tells you that it might make you drowsy, so you mustn't drive a car. This one says you mustn't take milk with it. Some products you should take milk with, some you mustn't. And these are put on. The important thing, Tom, is that everybody reads the label very carefully and listens to what the doctor and the chemist tells them, because it's not much good having the right medicine if you take it the wrong way.
Well, the doctor and the chemist look after our general health, but there are some parts of the body which require particular attention. Angela, what's the role of the dentist? Is it just filling cavities?
No, Tom, it's not actually. We're trying to get away from just filling cavities. The role of a dentist is to really look after the whole mouth, and in fact one of the biggest roles nowadays is to try and prevent the cavities from starting. And here we're concerned with educating people and teaching them how to stop cavities.
What sort of dentists are there?
Well, there's a general practitioner dentist, just like we have with doctors. He is capable of looking after all the different facets of dentistry. And also we have dental specialists. These are people more trained in certain areas. They've had more experience and have greater skills. And we have, in this field, we have specialists like orthodontists. These are people who look after crooked teeth and fix them up by using bands or plates and things. And there are other specialist dentists like oral surgeons who are concerned with taking out perhaps more complicated teeth and other things.
What sort of things can go wrong with your gums and your teeth that require you to go along and see a dentist?
Well, the two main things that go wrong are dental decay, which is holes in your teeth, and gum disease, which is basically an infection of the gum. And these two things are caused by the same factor, and that's plaque. And plaque is just, as we showed in the film before, it's that stuff the dentist can stain up to show you that film on your teeth. And it's basically just consists of food that you put in your mouth and the bacteria we have in our mouth, those little bugs that live there all the time, which feed on the plaque.
What sort of things can people do to make sure that they don't have problems with their teeth and their gums?
Well, the most important thing to do, of course, is to decrease the amount of plaque in your mouth. It's very important to firstly look after your diet, and in this regard we mean you've got to cut down on sugar in your diet, because it's the sugar part of the plaque that causes the holes. The second thing to do is to brush your teeth properly, and here, looking at our friend, we can show you that with a proper toothbrush, a soft one, we have to look after brushing not only the outside of the teeth here, but also on the inside too. We have to keep all the surfaces of the teeth clean. Of course, the toothbrush can't get in between teeth, so we have to use something else there to get in between teeth.